paying for a thousands of dollar ambulance ride across town or taking a bus ride when you're in active labor. Like it's just unbelievable that they have so little compassion for our patients and for the community that they think that that's a reasonable solution.
Welcome to Fight Back Radio, production of fightbacknews.org, taking you to the heart of the people's struggle. I'm your host, Richard Berg. And today I want to dedicate our show to a sister, a comrade who died just before Christmas, Charlene Mitchell. And a lot has been written about Charlene. And, she was, I guess most famously, she was the first black woman to run for president of the United States, but that doesn't tell the story at all. She was obviously, she was a freedom fighter. She was a communist, a leader of the Black Liberation Movement. I would say, she was the founder of the Committee to Free Angela Davis and all political prisoners, and she took that seriously. She fought not, obviously the great victory of releasing Angela Davis from jail in the late 60s, early 70s, but all the people that she got out of jail, all the freedom fighters, some known, some not so much, and not just her, she did it by organizing broad masses of people across the United States and across the world, and taught people how to organize and how to do the things that we need to do. So it's a huge loss to us. I want to read just a quick paragraph from Fight Back News remembrances that Frank Chapman wrote about Charlene Mitchell, and we'll print this in the show notes. But if you don't know who Charlene Mitchell is, go to our show notes, read the obituary from Frank. But also, check out some more about her. This is somebody that you should know. But Frank says Charlene was an architect and a strategic leader of the most massive defense campaign in history, defending the Black Liberation Movement, the democratic rights of workers and oppressed people, and the rights of revolutionaries, be they communist, national, oppressed, or both. And that's Charlene Mitchell, and our tribute is our show today is in her honor. So, and we have a good show. We're going to talk about healthcare today. We have Tracey Schwerdtfeger, who's a registered nurse who works in Milwaukee. She's a member of the Wisconsin Federation of Nurses and Healthcare Professionals. She works at Ascension St. Francis, which was one of the larger hospitals on the south side of Milwaukee. And she's going to talk about how her employer, but across the country as well, how our healthcare industry puts dollars before people. And she sees this firsthand as a registered nurse. And I should say this too, before she was a registered nurse, she was also in healthcare. She was working as a certified nurse's aide. And so she's seen this across the board. And so I think you'll find this show interesting. I was listening to the radio this morning, and a couple of stats they rattled off about healthcare that caught my attention that I want to pass on to. This is from our friends at Democracy Now! 500,000 people in the United States, or 500,000 people a year, declare bankruptcy because of their healthcare debt. And think about that. It's like, I have a heart attack, I have a stroke, I get cancer, something, a tragic thing in my life, and now I lose my house, or I have to commit, declare bankruptcy. Or even worse, some of issues about emotional and mental illness that people are struggling with, and they go into debt because of it. And now they have what they're trying to get fixed is made worse by the healthcare industry. So I would, as you're listening to what Tracey talk in the interview today, think about some of these things too. Also, the statistic that was mentioned was 68,000 Americans a year die because they don't get the proper health care because they can't afford it. So people, they finally do go to the doctor, and the doctor says, "Oh my God, you're dying. I could have fixed this if you'd have come sooner." Well, I don't have health insurance. What the heck is that? I mean, come on. I mean, what kind of country do we live in that is killing people just to make a few bucks off of their health care? The fact that we've made this a commodity and that we treat people this way is a terrible thing. And Tracey talks to all these things, and I think you'll enjoy our interview with Tracey Schwerdtfeger. Here she is. So, welcome to Fight Back Radio, Tracey.
Thank you for having me.
Yes, it's good to have you. We're going to talk a little bit about healthcare today, and your work as a registered nurse at Ascension St. Francis in Milwaukee, Wisconsin. And they just announced that they're planning to close their labor and delivery part of the hospital. And so, you guys have been opposed to that. Why is that a problem?
Yeah, so on December 16th, our administration met with our union officers and some of our staff from the labor and delivery unit and let us know that they would be closing the labor and delivery unit in 1 week's time on December 23rd, so 2 days before Christmas. It was a really big problem because they gave us a 7-day notice, which was a pretty short amount of time to tell, some of our union nurses had been there for over 20 or 30 years. So it was a pretty short amount of time to give us. And then also, this is the only labor and delivery unit on the south side of Milwaukee. So there is an entire section of Milwaukee that is primarily like lower income immigrant community that is without a labor and delivery unit now.
So so they came to you. You're involved in the union, right? You're the president of the nurses bargaining unit, or am I correct? At Ascension St. Francis for the Wisconsin Federation of Nurses and Healthcare Professionals. Did I get all that right?
Yes, that's correct.
Okay, so you're one of the union leaders at St. Francis. They come to you with 2 weeks. What did you guys do? I mean, my God, it's like that's not very much notice.
Yeah, so they gave us 1 week's notice, and actually during the meeting, I actually immediately started texting our staff and some of our community activists that we had already been working with. The writing was kind of on the wall that we had a feeling that this was going to happen, and services in general have been declining at our hospital for the past really year, but since Ascension took our facility over in 2016. So we had already started the foundations of a community coalition to save services at the hospital. So during the meeting with administration, I immediately began texting people saying that the unit was closing, that we needed to have a strong response to this. In the meeting, too, administrators had actually lied to us and said that they had contacted all public officials in Milwaukee that would have been affected by this decision, including like alderman, which is our version of a city council, and the mayor. And we immediately actually began calling offices, and we had found out from every single public official that they were actually not contacted until after this meeting. So, our response was pretty strong and pretty swift. And then on Monday, we made a press release, and we immediately started doing interviews and have had 2 rallies since, including one rally in front of the CEO of Ascension, Wisconsin's house, his private residence on the east side of Milwaukee.
Well, let's talk about that a little bit. So you had a couple of rallies, one in front of the president's house, and so who showed up at these rallies? You talked about work with the community. It sounds like you were scrambling quickly, but who were you able to pull together? I mean, I'm guessing some of the workers who were about to lose their jobs, but beyond that, who were you able to get to support the effort on that short a notice?
So actually, none of the workers who were being impacted by the closure of this unit were actually able to come to the actions. They were offered a severance package, and the severance package actually explicitly said that they could not say anything negative about Ascension on social media or to the media. So as the representative of nurses at the facility, I have actually been speaking on behalf of nurses because, they're unable to do that themselves. So I'm speaking as the union president of the registered nurses at St. Francis. But at these rallies, we did have other workers from other departments, other specialties and areas at the facility that are not registered nurses come and support the effort. And we've also had quite a few community organizations come out and support us. At both rallies, we actually had elected officials come. At the first rally, we had a state senator come, an alderman, and then at the rally in front of the executive's house, we had a alderwoman who represents an area on the south side of Milwaukee that is very much opposed to the closure of the unit as well. So though it has been a short amount of time, I think that we've done a really good job of getting a lot of community support, a lot of elected official support. And I know I've personally done about 6 interviews, so we are getting a lot of media attention on this issue too, which is really fantastic, because not only is it terrible for the workers, it's just a devastating loss for the community that we will no longer have that service available to the patients that we serve.
So let's talk about that a little bit. So for people we have a national audience here. So for people that aren't familiar with the south side of Milwaukee, or where St. Francis is located, what community, what area does this hospital serve? What community? What kind of people? And right now, now that the labor and delivery is gone, where do they have to go to if they to deliver their children, or to have these services?
Right. So since this is a national audience, I actually want to answer your question kind of in the national context of what Ascension is doing nationally. Because the same week that our labor and delivery unit was closed in Milwaukee, they also closed one in Michigan and another community. They have hospitals all over the country, Midwest and Southeast a lot, like Florida. And the community that we serve primarily is we have a lot of state insurance patients, so it's a lot of Medicaid, Medicare. We have a lot of immigrants who are the main population that we serve. A lot of folks who
These
don't
are the
speak
lower
English.
sectors of the working class and oppressed nationality people, largely.
Yes. Again, bringing this kind of to the national context, there's a lot of small community hospitals that Ascension has taken over. And, this is a very common patient population of a lot of their smaller hospitals. So when they closed the labor and delivery unit in Milwaukee, in Detroit, it's not just like they're targeting the south side of Milwaukee. What they're doing is that they're eliminating services from a lot of poor communities that don't necessarily have access to the other services that what we're seeing in more private pay hospital environments, like in the suburbs and wealthier areas.
And this is primarily because they're on a public aid of some kind, of a Medicaid or Medicare, and so what you're saying, even though it's a religious Ascension, was it Catholic, I assume, or that this is no longer like, oh, we're doing a charity. It's more like, this is profit driven, and the places that have good insurance get good health care, and the places where people are relied on, public health insurance, they're getting the short end.
Yeah, so Ascension is a Catholic non-for-profit organization, and in our union's opinion, we do not believe that they are serving their mission, which they say is to serve the poor and to provide access to healthcare to folks who may have other barriers to gaining access to healthcare. So we truly believe that, St. Francis and other facilities where they're doing similar things of eliminating or reducing services is really going against the mission that they like to state. And it kind of makes us question why they have a nonprofit status in the first place, because they avoid, millions of dollars in taxes every year for having facilities open like the one that I work at.
Well, how do they answer that? I mean, so their mission is to serve the poor, and here they are, cutting back services in poor areas, and maybe not as much in the areas that have a little more money. So
they don't really have a response. A lot of the media that we've had surrounding this issue, specifically in Milwaukee, they just really haven't been providing a lot of responses to the media. The responses that they do have are basically talking about staffing issues, which we definitely do have staffing issues, but we also know that they have staffing issues at all their facilities, which I hope we get to talk about later in the program. But another thing that they had said is that they weren't actually able to find physicians to take positions to work at our hospital, which we actually had confirmation is not true. There was two physicians who actually wanted to work and build the program at St. Francis, but the Ascension specifically did not hire them. So that's kind of the narrative that they're providing for the media. So it doesn't directly answer your question. And the reason I can't directly answer your question is because they're not really responding to that. When we've said that this leaves a hole in the community, they said, well, they can just go to other facilities. So the two other facilities that they had suggested that our patients go is about a 20-minute car ride or an hour-long bus ride.
Wow.
So just imagining if someone's in active labor with a complicated pregnancy, and the audacity that our administrators say, well, they can just go to another facility, especially for folks who don't have insurance, which we see quite a few people who don't have insurance. The thought of paying for a thousands of dollar ambulance ride across town or taking a bus ride when you're in active labor, like it's just unbelievable that they have so little compassion for our patients and for the community that they think that that's a reasonable solution.
Yeah. Wow. Well, let's. I mean, it seems like there's a lack of transparency. I mean, they don't want to, say anything, or they don't have answers, and then they use a severance package, which people I'm sure need to survive, as a gag order on your members' ability to speak out about what's going on. But let's circle back, as you said. Let's talk about staffing a little bit. Is Ascension St. Francis or the other Ascensions, are these good places to work? Is this do they provide good do they staff their hospitals adequately for what's required to provide good health care?
So I just want to say I love working at St. Francis. I've been there for 7 years in April. I love my coworkers, and I really deeply care for the patients that we see. I work on a cardiac floor, so I will sometimes see the same folks, or like I've been working with the same physicians for a long time, and it's a really just incredible experience to be able to work at such a small community hospital where we all know each other. A lot of our physicians have been seeing their patients for decades, so it's just in that sense, it's a really fantastic place to work, and I wouldn't trade it for the world. On the other hand, our staffing, especially in the last year, but really since Ascension has really implemented a lot of their changes in the last 4 to 5 years, our staffing has really declined significantly. The safe ratio that management has actually agreed for us on the unit that I work on, cardiac step down, is 1 to 4 patients, and sometimes they expect us to work with as many as 6. And I've actually been asked to take a 7th patient several times, which I've refused. And so I've refused to take a patient assignment because I'm protected by the contract, and
the union contract you're talking about.
Yes, I'm protected by our union contract to be able to say that it is it's unsafe. However, we do know that at other Ascension facilities, because the Milwaukee is the largest metro area in Wisconsin, it's not that large. Like a lot of people know each other, and we know that, for example, at some of their Ascensions, like fancier, more like private pay facilities, some nurses are being expected to take as many as 10 to 12 patients. And this has become a normal thing, in the last couple months. I actually was working this past weekend, and I was informed that there are nurses at a different facility in the suburbs who have actually started to come to work, and they're refusing to punch in and will go home because they're walking into a day where they have a 10 patient assignment. So, the thing with nursing is that if you punch in and you take your assignment and you leave, it's considered patient abandonment. But if you don't punch in and you don't take the assignment, then it's not a hit against your license. So nurses are literally walking in, seeing what their patient assignment is, and just going home because it is just such an incredibly unsafe environment for not only for the staff, right? Like we're concerned about safe working environment, of course, like as, workers, union members, but ultimately the thing in healthcare that we're the most concerned about is our patient safety, and expecting nurses and techs to care for that many patients is really just unbelievable. And I know that that was a big issue that had happened just in the New York nurses strike that I think we can really look to see what the power that the workers do have to stand up against some of these unsafe staffing ratios. And the last thing I want to say is that at St. Francis, what we have the benefit of is the union contract. I spoke with someone recently who is a regional pool nurse, and they were saying that at one of the other facilities I had mentioned, where nurses are being expected to take 10 to 12 patients, that if they say anything to management at all, that they'll like immediately get written up or
Oh my
disciplined.
gosh.
So I know that,
Oh my
from
gosh.
my own personal experience, again, like I refuse to take additional patients when I'm concerned about patient safety, especially when, as a cardiac nurse, the level of care that we need to provide for people, especially if they're getting out of a procedure like a cardiac catheterization, is pretty high level. And if we're not able to respond quickly, it can be life-threatening. So that's why we stand up for our patients. And that's why I want to really bring it back to working at a union hospital is really incredible. And again, seeing what they were able to do in New York just should really show us nationally like the power that the workers and nurses have for safer staffing ratios for better care for our patients.
So this has been an issue, the staffing thing, for some time. I know there was a huge campaign in California, maybe a decade back or more, to have actually staffing ratios put into the state law, and they followed at that time Governor Schwarzenegger around the nurses union did, and eventually they won some level of staffing ratios, which became a model. But you're right. There's a big strike just happened in New York City. There was a number of hospitals that were about to go on strike. There were, I think I heard 13,000 people, but then some of them settled, and it was maybe 7,000 nurses eventually went out on strike over staffing issues. Can you talk about a little bit about the situation in New York, and how is this true everywhere, or what's going on in New York City, and what are they hoping to win over there?
So the really big victory that they were able to pull off in New York is really related to everything that I was just discussing. I don't have specifics of every single facility, or especially every Ascension facility, to which I want to say actually too that, this isn't just the company that I work for, right? Like this is the healthcare companies in general. A lot of these corporations are being, and they're corporations, right? Like they may like to say that they're Catholic nonprofits or whatever, but they're being run as for-profit corporations, and they're being run by millionaires. And the real effect that we're seeing of when they're, kind of hoarding the wealth up at the top administration, is that what we're seeing on the floors in the hospital is that our staffing ratios are just unbelievable. Like the ratios that I was just saying of going up to 7 patients, I was reading the exact same thing was happening in New York, and that's why they went on strike. Because this is an issue that's happening nationally, because again, these companies are being run by millionaires who don't want to put the resources into staffing their hospitals, because they're not going to make as much of a profit if there's an adequate amount of nurses for their patients, or like for our patients. So another key example that I want to bring up, that's not actually New York, but I think it's really relevant to the struggle in Milwaukee, New York. Anywhere that you go in this, any large urban area you go in this country, and probably rural areas too, I think we're all kind of facing the same issues as nurses. But there was actually a nurse in Washington State a couple months ago who was expected to care for 19 patients in an emergency room. She tried to talk to
Oh my
administration.
God, 19 patients.
19 patients in an emergency room, and I'm not an ER nurse. That's like it's a whole different specialty. But in the ER too, it doesn't stop, right? If someone has chest pain, they're coming to ER. Like we we can't ethically or legally turn people away from the emergency room. So anyways, this nurse was expected to care for 19 patients, and she actually called 911 to have paramedics come and help her, because a lot of paramedics have the same kind of skill set as like emergency room technicians. So they actually came to help her. And then that hospital was actually at threat of losing accreditation because she had to call 911. But I think that, we were talking about that in my workplace, and, the reaction from every single nurse that I talked to is like, wow, I can completely understand why they wanted to call 911, because even though if this is in Washington or New York, like I said, this is an issue that we're facing as not only as nurses, but all staff in hospitals, that we are facing a shortage that is created by administration. This has nothing to do with like a nursing shortage or a worker shortage. This is something that administration has designed so that they can extract the most amount of profit from the healthcare system, while the people who are suffering are nurses, CNAs, imaging technicians, and our patients most of all.
Okay, well, let's talk about the money behind healthcare a little bit. We had Greg Kelly, who's the president of SEIU Healthcare, Illinois, Indiana, Kansas, and Missouri, on our show, and he talked a little bit about the problems with money in healthcare. I encourage our Fight Back Radio listeners, if you haven't heard that episode, to go back and check that one out too. It's a good compliment to what Tracey's telling us right now. But let me ask you about a single payer healthcare. I mean, we had a huge debates in this country. We've had them for quite a while. The Obamacare, or the Affordable Care Act, finally passed, and for many people on the right, that was outrageous. But for others, they said, "Oh, this is good enough. Now we're okay. We don't have to worry about healthcare issues." But what you seem to be saying is that this continues to be a problem. It's like the rich are using our healthcare facilities to line their pockets, and at the expense of actual care for regular people.
Yeah, so I don't think there's any other way that I can talk about this issue other than to say it's inhumane to not provide every single person with health insurance. It's just unbelievable to me that this is even a debate or a question in people's minds. As a nurse who, a part of what I do is like discharge planning for helping people to be successful so that they don't have to come back to the hospital, especially too, because I take care of a lot of folks who don't have insurance. I really see the amount of work that our team puts into helping people try to be successful when they leave the hospital is a lot, So like one thing that I like to bring up when this issue of single payer, or whether or not people deserve to have health insurance, is the issue of insulin. And I know that this is something that's been in the news a lot in the last couple of years because the prices have really gone up. But, I just really want to break it down to a very basic level that hopefully everyone who's listening can understand. If someone is diabetic and they don't control their blood sugar with insulin, there's a lot of different problems that can happen. But, one of the biggest problems that can happen from uncontrolled blood sugar is that they'll get to a point where they'll have to have their foot amputated or their leg amputated. Because the thing is that, like, if you don't have access to the medications that you need to treat a chronic illness, then what are patients supposed to do? What are people supposed to do? So, coming back to Wisconsin, someone who is very famous that a lot of people probably recognize, his name is Paul Ryan, who was a House member for a long time, that was, absolutely opposed to, Medicare for all, single payer, whatever.
He's the Speaker of the House for many years.
And
discussed about being president, actually. So go on. I'm sorry.
Yeah. So he, he's very, very opposed to any kind of, non-private paid healthcare system in general. But, it's how much is someone's foot worth to these people? I mean, because literally, that's what we're talking about. When people don't have access to health insurance or medications that they need, Like that is the road that we're discussing about going down. Like people like unable to be able to control some of these chronic illnesses, or even just the fact of like, heart disease is the number one killer in the United States right now. And if we just were able to have some sort of real preventative care available to people, like we would be able to actually like treat folks before they're getting to an emergency state of having to come to the hospital. So, going back to your question of like, just single payer insurance, it is unbelievable to me that we are still having this debate in this country. And as a frontline healthcare worker, I just am absolutely disgusted that everyone doesn't have insurance. It doesn't make any sense to me. I don't know how else to put it.
No, it makes sense. I mean, besides being an active member of your union and an active working registered nurse, you're also a socialist. You're a member of the Freedom Road Socialist Organization, and some of you just said some of what a socialist program for healthcare could look like. But could you go beyond that? What in terms of why? I mean, why as a socialist, how do you see healthcare? What are the kinds of things we should be fighting for, even outside the hospital or beyond that, or you can take it whatever direction you want to.
Yeah, so I think that the number one thing that we need to be fighting against as socialists, but like just as a broader community in general, is really the concentration of wealth at the top of these healthcare corporations. The company that I work for, the last public record, the CEO made over $14 million a year. And our lowest paid workers in our facility, the minimum wage is $15 an hour. And we fought very hard against that in our last contract. And our administration said that they felt comfortable with people making $15 an hour. So, when we talk about like what does
sure
healthcare
they do,
look
because
like,
they can make they get the rest of it.
right. Well, and that's why they're making millions of dollars, And so when we talk about like what do we want to see healthcare look like in general, there's two aspects of it, right? There's the aspect of the actual care we're able to provide people, and then there's the people who are providing the care. So I think that on the one hand, for the people who are providing the care, and it's not just nurses, because I think a lot of times in this debate, or like when we're talking about COVID or healthcare reform in general, like a lot of times like nurses and doctors are really the folks who kind of get put up on a pedestal. But I just want to say that it is every single person in a facility, whether it be a nursing home or a hospital or a clinic, that makes the facility run. If we didn't have housekeepers cleaning our rooms, the state would shut us down. If we didn't have people cleaning surgical tools, like the rate of infection, like we wouldn't be able to perform surgeries, right? If we didn't have CNAs, like people would literally be laying in their own pee, I mean, just to put it bluntly. So like, I think on the one hand, what a good healthcare system looks like under socialism is for the workers to actually be taken care of properly. And for the top administrators to not be having this incredible amount of hoarded wealth of what we're seeing now. And that's what it is. It's hoarded wealth. And it is coming at the expense again of us. So then on the other hand, when we're talking about what does the care actually look like in socialized medicine, I think what we're talking about is people who are truly able to receive preventative care, true education about different disease processes, nutrition, like real access to quality facilities that, again, and it goes back to staffing, like everyone deserves to go into a hospital and have their nurse or their CNA have the time to actually spend and provide education and care for them. And I think just in general, going back to the issue of labor and delivery, that and socializing, that everyone will have the ability to actually access the services in a meaningful way, to not be expected to take an hour-long bus ride, to be able to access an essential service to them, that things will be readily available to people in a way where they're actually able to participate in the system and benefit from it.
No, that sounds wonderful. I mean, I noticed I'm not an expert on healthcare in the socialist countries, but I know I was able to visit Cuba, and I noticed that they had the clinics in the neighborhoods were tied to the schools. So the doctor lived at a house, and his clinic was connected to his house, and so everybody knew where it was. Everybody knew where the schools were, and they could get to them quickly if they needed to. And also it was good for if there was any kinds of issues amongst the children in the schools as well. Another thing I noticed was in China right after the revolution there, both those two countries prioritized healthcare in a very big way for workers and peasants. And they started they had what they called the barefoot doctors in China, which was people that they would send to the countryside, that maybe weren't full doctors or nurses, but they would combine their training, maybe in like first aid and learning how to do things that were most commonly seen out there, just to provide some kind of health care. And then both of those countries have built themselves up into being some of the best health care provided for the top of the chain down to the poorest people in their countries. So it's I can see, I can see what you're saying about that. Also, I want to give you a thank you. I worked in healthcare for 20 years, and I was a housekeeper. And often when people talk about healthcare, it's doctors and nurses. But the people that, you're right, the people that keep the place clean are important. If you get an infection, it can mess you up in a big way. And as the corporatization of healthcare happened, at that time, we called they replaced the healthcare professionals with what we called bean counters, and which were the money people you're talking about, who are running healthcare now. And one of the things they did, not just with nurses but with everybody, they scaled down the number of people that were cleaning the place, and you were expected to, before you were, if you went into this room, you shouldn't come out until it's completely sanitized. Now it's like you got this much time in the room and you better be out no matter what, no matter what the state of it is at that time, and into the next room. So it's a terrible thing. Let me pivot back to your union, and you spoke. You're a proud union member. What kinds of things can a fighting union do to try to improve things? And then you've spoke about some of them and some of the things that you're doing. But for healthcare unions, what advice would you give to people, our listeners around the country, if they're working in healthcare, to advocate for in their unions and trying to get their unions to fight for the kind of healthcare, whether it be staffing or otherwise, that we need?
Yeah, so I would say that one of the biggest things that we're doing is that we're actually trying to fight, right? So I know that might sound so simple, but I would say that really in the last year, we've really been a lot more aggressive and militant with our tactics. Something that had happened over the summer was that after our contract got signed, so legally the way that it works in hospitals is that there's different bargaining units. So like the nurses we're not in the same bargaining unit as the techs. And when I say tech, like I'm not just saying CNA, like I'm talking about like there are so many classifications. There's so much work.
CNA is the nurse's aides, and it could be like phlebotomist, or is that what you're talking about? Or
like X-ray techs,
okay,
admissions. Like there are so many important people. Again, going back to the previous statement, there are so many important people that help a hospital run.
Yeah.
And so anyways, when we finally signed our contract, which was about a 9-month bargaining process, and we, went to mediation, that's like a whole different thing. But we had actually had the nurses, we all got our raises. Like in the contract language, it was a certain amount of days after the ratification that we would get our raises. And it was supposed to be the same for the techs. And they didn't get the raises. And it had been like over a month of people not getting the raises. People were contacting us, our own people in leadership had not been seeing these raises, and it really was negatively impacting people because we were able to see some pretty decent raises for just different classifications through this last contract. And so what we actually did after, weeks of email administration and no real answers, we actually organized a group of about 20 people to do a small march on our administrator's office. And to which in 30 seconds, he called security on us, which is, kind of funny. And we had a really fun meme, and, we're kind of making fun of administration for that. But like in our union newsletter, but, I think it was 2 days after that happened, everyone got their raises, right? So, like as simple as it sounds, actually doing like fighting and like militant actions is something that's really important, because like some folks, I think, who maybe have not seen this type of action before are people are so frustrated with what's going on with our staffing situation, that by us being able to show the leadership to say, hey, like we can actually do something and be successful at it, and you don't need to be scared, because we have these rights as workers to be able to do these types of actions. Like when we held the protest outside of the CEO of Ascension's house, the company had actually contacted different media in Milwaukee to tell them that they could not show up to cover the protest because it would be, they were trying to say that we were doxing the CEO of Ascension, Wisconsin by releasing his personal address out onto the internet. And this obviously wasn't true. This was just, a tactic of the company to try to not have media coverage. And it's funny because NPR actually put it in their story that this is the first time, a company has done this, and it's very unusual. But I bring this up as an example too of like that this is another militant action, that this is concerted union activity. I think that is really my big advice. Talk to your coworkers, because I can guarantee you that there are a lot of people who, maybe they haven't said the most, but like if you work in a hospital, like, you're feeling what's going on right now. There is such a high level of solidarity in our facility right now going on over not only are we all united that the closure of the labor and delivery unit was just unbelievable and unacceptable, but there is a very high level of solidarity among all workers. It's not just, nurses and nurses. It's like every department. I feel like anyone I talk to from a different department is that we're all on the same page, that, like we all know that we have this like common issue going on of unsafe staffing. So really kind of building that solidarity too between the different classifications has been something that's been very important for us in this fight, because, there's a lot more of us than there are of administration. So when we work together and actually fight and show that kind of leadership, then we're going to be able to see the real kind of results that we want to get.
No, that's fabulous. It sounds like you're doing all the right things. You have a fighting program of struggle to actually win what needs to be won for yourselves and for the community. And it sounds like you've laid the groundwork. If you got nurses going to the boss's office and saying, pay the lower sector workers in other units, that creates a trust and a solidarity. And these staffing issues, you've reached out to the community, and it's impressive, and it sounds to me like it's a model for other places as well. Let me raise another issue, related to healthcare, but also to women's rights, is the issue of abortion. The Supreme Court, basically, they overturned the Roe versus Wade, which gave women the right to an abortion. And several states, including Wisconsin, where you're at, have outlawed abortion. And so, what's your view of that? What's the effect that that's had on women in Wisconsin, and how do you view it as a healthcare worker?
I'll just start by saying that the reason why I got involved in activism was actually through Planned Parenthood. For a lot of years when I was a college student, I worked with Planned Parenthood, volunteered. I did escorting at an abortion clinic in Milwaukee for a couple years. So this is a very important issue to me personally. And especially as a mom, I have 2 children. After I had my kids, I would say that, choice became even more important issue to me. because I truly understood, what it means to be a parent, and the sacrifices and the economic, impact that it had on me and my partner's life. So, when I remember very specifically, actually, when the announcement came out that Roe v. Wade was overturned, I was working and I started crying at the nurses. I was at the nurses station. I read it. I started crying. I was talking with all my coworkers about it. We were all incredibly upset about it. We don't work in an area of reproductive health care. However, I think that we all kind of understand that, like, just looking at it from, like, the healthcare worker side and working with a lot of different providers, understanding the impact that it had on folks who were either working for Planned Parenthood or for abortion clinics, to not be able to provide the services that they had dedicated their lives to, is just, I think it really just, like, hits you in a different way when you work in healthcare. But I would also say that, the real impact that it's having on women in Wisconsin, I don't know what other word to say other than it's devastating. Like, the right to abortion and reproductive health care is just a fundamental right, just in the way that so many of our other things that we take. And I would say that too. I'm 36 and I've always grown up with this idea of, like, access to abortion, like, it's fine. And, like, even when I volunteer for Planned Parenthood, it's like, oh, like, Roe v. Wade would never get overturned. Like, it was just never something that was, like, a real, like, it never seemed like it was reality. And it was just, like, such a shocking moment when it happened. And I think that being in a state where we don't have that access, like, what we're going to see is we're going to see people either traveling to other states, which I know that a lot of the states around us, where it is legal still in circumstances that, they're kind of like, come on over, like, which is really good, but, like, if you think about people who don't have that kind of access, or who are in a job where they can't take off multiple days in a row, it's like, the impact I think that it's going to have on people who have barriers to be able to travel out of state to get that healthcare that they need, is that people are going to start doing a lot more risky things. And what we're going to start to see is a lot more injuries and death. Like, that's what happened before Roe v. Wade, and that's what's going to start happening again. And it's really terrible.
It is. I want to give a shout out to Reproductive Justice Action Milwaukee, but also who's been fighting this in the Milwaukee County area, and there's a referendum coming up there in April. But across the country, I want to give a shout out to people that have stood up and fought for women's rights to abortions and to healthcare in general. Just this has been I hear what you're saying, Tracey. This is incredible. I'm surprised as you are that things have changed. But I grew up in Wisconsin, and I know in the last 10, 15 years it's been a rough go. I mean, Governor Walker, the previous Governor Walker, took away many of the labor rights that people had in Milwaukee. First the public sector, and then making it a right to work state. And now you see some of the laws that were put in effect with time bombs on them to pull away women's right to choose. But the Republicans are coming to Milwaukee for the Republican convention, and I know you and some others have been involved in this. Can you talk a little bit about the welcome that you're planning for the Republican Party when they come to Milwaukee to nominate their candidate for president?
Yeah, definitely. I'm really excited to discuss that a little bit. But just really quick before I go into that, I actually do want to just go back to the folks who do Reproductive Justice Action Milwaukee.
Please go ahead. Give me anything. I don't want to.
So I just want to say
fast.
That and again, and I feel like this is kind of going to be applicable to a national audience as well. That the folks that the work that those folks have been doing has been absolutely incredible. The actions that they've done, the fact that they've been able to get a referendum and working with, higher levels of like elected officials like in the county is just really, it's incredible. But it's also just, it provides a lot of hope, I think, to, not just folks in Milwaukee County, but I think to folks in Wisconsin in general, like if we are able to like keep moving forward, because again, this issue is so incredibly important and affects so many different people, that if we are able to make Milwaukee County like an abortion sanctuary, so to speak, it would really have such a huge impact on the rest of the state. And I just again want to say that the work that the folks in our gym have been doing has been really incredible, as well as the rest of the folks in the country that have been working around reproductive justice, particularly Roe v. Wade, over the past year. And it's, hopefully we're able to see some big wins there. So I will talk about the RNC now.
Sure, go ahead. But thank you for that. I'm sorry I didn't give you the chance to say a little more about our gym, but go ahead.
Yeah. So for the RNC, so we are planning to organize a protest. I think a lot of us were a little surprised when they announced that it would be here, because we just had the DNC here, and we organized a large protest against the DNC when it was here as well. It's obviously for some different issues, and we're expecting this protest to be quite a bit bigger and be able to have our coalition effort be quite a bit larger. But we have already created a website. We are already working with the ACLU, that we have, me and another union activist are actually going to be meeting with the ACLU within this next month, to basically have them on as like a retainer, because we're expecting the city to give us pushback, like they did during the DNC, about obtaining a permit to march. But I think that right now the big work that is going into it is by building a strong and broad-based coalition. I think that the message against the Republican Party is pretty unified in like a lot of different areas of work and activism, and we're really hoping to just have the largest event that we can possibly have. We're expecting downtown Milwaukee to be pretty nuts, and we're trying to prepare the best we can for it.
Okay. Well, thank you. So we're almost out of time here. Unfortunately, this has went quick, and I've enjoyed hearing you talk about healthcare and about Milwaukee and Wisconsin. I lived in Milwaukee for 6 years, and it's I still love that city, and so it's good to hear there's so many people fighting so hard. Are there any things that we haven't covered, or that we haven't covered sufficiently, that you wanna say or you want to add to?
I'm just trying to think, going back to the issue we have at hand at our facility of the labor and delivery unit closing. I think that, the biggest message that I have for folks listening is that this isn't just an issue that's impacting the south side of Milwaukee. This is the issue of healthcare and access to basic services, and for healthcare workers to be adequately taken care of in the facilities that we work in. This is a national issue, and I really just want to reiterate that when we fight, we win. There's a lot more of us than there are in administration. Healthcare is something that, though our administrators, I think, like to treat it as if it's some type of commodity, that we work in the industry for a reason. And we have the ability to fight back and to organize and to make healthcare into something that is actually more beneficial for the community, and that it can be a good profession again. During the pandemic, I had recently read something that over 100,000 nurses had left the bedside. And I think that, through strong organization and through fighting unions, that we can actually make bedside nursing and bedside work for imaging technicians, housekeepers, CNAs, all of the people who work in hospitals, that we can make it a better industry again, but we just need to, take those steps to organize, and we'll be able to provide the world-class care that we want to provide to our patients and our communities.
Well, thank you. Thank you for joining us on Fight Back Radio. And, I look forward to seeing you in Milwaukee at the Republican convention.
Okay, thank you.
Bye. So that's our show for today. I want to thank Tracey Schwerdtfeger for being our guest, and I hope you enjoyed the show. It was I think this whole thing of healthcare and where it's going is something we need to pay attention to, and it's something that our side, I think, being progressives and left and whatever socialists, our side is right about this. There's no, I mean, come on, we're killing people because of to make a few more bucks, or we're not providing the right kind of health care for folks. So anyways, I hope you enjoyed our episode of Fight Back Radio. Again, we encourage you to give us a good review. If you could write a review, or 5 stars, subscribe if you're on YouTube, or whatever, like it. And those things help people find us, and we really, really appreciate that. And so also I want to thank again our production team, which is just fabulous. Shane Tremley, Vince Olson, Dodd McColgan, they make all this stuff happen. And for the entire Fight Back Radio team, I'm Richard Berg saying until next time, all power to the people.